Good day, everyone. Today's lecture is about the nursing process in the care of the community. The nursing process in the care of the community. Talking about a community, this is a group of people who have a common interest or characteristics, who interact with one another and have a sense of unity or belonging. They function collectively within a defined social structure to address common concern. The community health nurses aim to improve the health status of a community in general. A community may be a phenomenological or a geopolitical community. When we say a phenomenological community, this describes as functional communities, which refer to the relation or interactive groups in which the place or setting is more abstract and people share a group of perspective or identity based on culture, values, history, interests, and goals. Example like the school, colleges, universities, church, and other various groups and organizations. Whereas when we say geopolitical community, this is also called as the territorial communities, which form by both natural and man-made boundaries, which include the barangays, municipalities, the cities, the provinces, the regions, and the nations. We have principles of community health nursing. First, it focuses on the community as the unit of the care. Another, it gives priority to community needs. It works with the community as an equal partner of the health team. In selecting appropriate activities, it focuses on the primary prevention. It also promotes a healthful physical and psychosocial environment. It reaches out to all who may benefit from a specific service. It promotes optimum use of resources. It collaborates with others working in the community. There are conditions in the community affecting the health of the people. A community has three features. First, the location. Second, people. Third, the social system. It is useful to think of these dimensions of every community as a rough map to follow or during the assessment, needs or planning for service provision. Talking about location, every physical community carries out daily existence in a specific geographic location. The health of the community is affected by this location, including the placement of health services, the geographic features like the plants, the animals, and the human-made environment. There are 6 location variables, like when we say community boundaries, which to talk about community in any sense, one must first describe its boundaries. It serves as basis for measuring incidence of wellness and illness and for determining spread of a disease. Next, we have allocation of health services. When assessing a community, the community health nurse will want to identify the major health centers and know they are located. The use of health services depends on availability and accessibility. We also have geographic features. Communities have been constructed in every suitable physical environment, and that environment certainly can affect the health of a community. Injury, the death, and the destruction may be caused by floods, cyclones, earthquakes, the volcanoes, and etc. Recreational activities at lakes, seashores, mountains promote health and wellness. We also have the climate. The climate has a direct effect on health of a community, like the extreme heat or cold. Another is the flora. Poisonous plants and disease-carrying animals can affect community health. Another, talking about the location, is the human-made environment. All human influences on environment, like the housing, the dams, farming, types of industry, the chemical waste, the air pollution, and other things. They can influence levels of community wellness. Next, we have the people. The people consist not only of a specialized aggregate, but also all of the diverse people who live within the boundaries of the community. The health of any community is greatly influenced by the population that lives in it. Different features of the population suggest the health needs and provide basis for health planning. Population variables like the size, density, composition, the rate of growth or decline, which rapidly growing communities may place extensive demands on health services, will mark decline in population may signal a poorly functioning community. We also have another reasons why people will differ from each other because of the culture. Cultural difference, which health needs may vary among cultural and ethnic populations. Cultural difference can create conflicting or competing demands for the resources and services or create intergroup hostility. The social class and educational levels of the people refers to the ranking of groups within society by income, education, occupation, the prestige, or a combination of these factors. The educational level is a powerful determinant of a health-related behavior. Next, the social system. The social system, in addition to location and population or the people, every community has a third dimension, which we call the social system. The various parts of community social system that interact and influence the system are called social system variables. These variables include the health, family, economic, educational, religious, welfare, legal, communication, recreational, and the political systems. Although community health nurses must examine all the systems in the community and how they interact. The health system is of particular importance to community, the health of the community. We also have characteristics of a healthy community. These include a shared sense of being a community based on history and values. A general feeling of empowerment and control over matters that affect the community as a whole. existing structures that allow subgroups within the community to participate in decision-making in community matters. The ability to cope with change, solve problems, and manage conflicts within the community through acceptable means. Open channels of communication and cooperation among the members of the community. And also, there should be equitable and efficient use of community resources with a view towards sustaining natural resources. Community assessment. The data that need to be collected depend on the objectives of community assessment. The data needed to be collected depend on the objectives of community assessment, wherein the community assessment is the process of identifying the strengths, assets, needs, and challenges of a specified community. In general, the need the nurse needs to collect data on the three categories of a community health determinants, like the people, the place, or the location, and the social system. We have a patch model. The patch, the acronym for Planned Approach to Community Health. This is a cooperative program for technical assistance managed and supported by the CDC, or the Centers for Disease Control. The patch is a community health planning model that was developed in the mid-1980s by the Centers for Disease Control and Prevention, or the CDC, in partnership with state and local health departments and community groups. The patch is designed to strengthen state and local health departments' capacities to plan, implement, and evaluate community-based health promotion activities targeted toward priority health problems. There are different ways of community assessment: the comprehensive needs assessment and through a problem-oriented assessment. A comprehensive needs assessment wherein the nurse gathers information about the entire community using systematic process where the data is collected regarding all aspects of the community to be able to identify actual and potential health problems. The second is the problem-oriented assessment. It focuses on the particular aspect of health wherein the nurse collects information with a certain community problem in mind and then proceeds to gather information from the aggregate vulnerable to the problem. There are different tools for community assessment. The community needs, perceptions, and demand, when the community assessment tool can be used by countries like the Philippines to rapidly assess and respond to community health needs and perceptions around access and effective use of essential health services. Assessing your community's strengths, weaknesses, the needs, and the assets is an essential first step in planning an effective project or a program. By taking time to learn about the community, you can discover the most relevant opportunities for projects and maximize your organization's ability to make a meaningful impact. Collecting primary data such as doing the observation or through ocular survey or windshield survey. Surveys are popular methods for collecting information and opinions. In the context of a community assessment, a survey can be an effective way to assess the community's perceived strengths, weaknesses, needs, and existing assets. Surveys can be general or targeted to a specific segments of the community. Another survey can be delivered by email or phone or better in person. We also have informant interview. Talks to the community people and the key informants, which consist of formal and informal community leaders or persons of position and influence. Interviews are one-on-one conversations between a facilitator, wherein you are the interviewer, and a community stakeholder, the respondents, or the people living in a village or in a community. Interviews allow you to gain a deeper understanding of the respondents' ideas and feelings. Unlike the surveys, interviews give the facilitator the freedom to not use a script somehow and ask follow-up questions. And unlike group assessments such as community discussions and focus groups, the respondent has the facilitator's sole attention and is more likely to share personal opinions freely. We also have community forum, for example, pulong-pulong sa barangay, and a focus group. A focus group is a carefully guided discussion used to determine a target group's preferences and opinions on a particular issue or idea. It can help you determine how stakeholders or the community people believe about their community issues should be addressed. Conducting a focus group requires careful planning and a skilled discussion facilitator. Most focus groups consist of 6 to 12 stakeholders or community people, and participants are asked a series of carefully worded, open-ended questions on different issues in the community. This approach promotes self-disclosure among the participants. In a group setting, a dialogue tends to evolve and participants build on each other's responses. Effective focus group will seem more like a collaborative discussion than a debate. It's most effective to conduct a focus group in a private, comfortable setting with one facilitator and someone to record participant responses. We also have a secondary data source. These include the health records and reports. Usually sources include administrative data, claims-based data sets, and electronic health records, health surveys, the patient or disease or both registries. Like we also have in the Philippines, we have field health service information or the FHSIS recording and reporting tools. This FHSIS is a basis for priority setting by local governments, planning and decision making at different levels like in barangay, municipality, district, provincial, and national, monitoring and evaluating health program implementation. We have also civil registration and vital statistics systems or CRVS systems. In most countries, a civil registration system is used to record statistics on vital events such as the birth, the death, marriages, divorces, and fetal deaths. This government administrative system creates a permanent record of each event. A well-functioning what we call CRVS system aims to secure individuals with recognition of their legal identity, and ensure rights of access to public services, social protection, and human rights. Another aim or the goal of this CRVS system is to generate statistics on population dynamics and health indicators on a continuous basis for a country as a whole and at a local level for its administrative subdivisions. Another aim is to generate essential statistical information that decision makers depend on for policy formulation, planning and implementation, and also monitoring. Lastly, another aim is it permit the understanding of the prevalence, distribution, and causes of mortality, as well as the identity, health inequalities, and priorities. Civil registration is defined by United Nations as the continuous, permanent, compulsory, and universal recording of the occurrence and characteristics of vital events like live births, death, fetal deaths, marriages, and divorces, and other civil status events pertaining to the population as provided by a decree, law, or regulation in accordance with the legal requirements in each country. Vital statistics system is the total process of collecting by registration, enumeration, or indirect estimation of information on the frequency of occurrence of certain vital events, as well as relevant characteristics of the events themselves and of the persons concerned. And it is a total process of compiling, analyzing, evaluating, presenting, and disseminating those data in statistical form. One of the basic premises of a vital statistics system is that every event should be reported for statistical purposes for all geographic areas and all population subgroups. And the data and the analysis need to be disseminated to be useful. Unless the data are available to the public, its willingness to support the system cannot be expected. What are the laws that govern civil registration? Civil registration in the Philippines was made compulsory with the enactment of the Civil Registry Law, which is also known as the Act number 3753, approved on November 26, 1930, and which took effect on February 27, 1931. There are also other laws that govern civil registration. The Act 3753 mandates the registration of all facts and acts concerning the civil status of persons from birth to death, including the changes in civil status taking place therein, appropriate civil registry books. We have other law, which is the Commonwealth Act 591 in 1940, which is an act to create Bureau of Census and Statistics to consolidate statistical activities of the government therein. One of the functions given to the newly created Bureau was to carry out and administer the provisions of Act number 3753, wherein the functions of the Division of Archives of the National Library, as well as those of the vital statistics of the Bureau of Health, were transferred to the Bureau of Census and Statistics. The director of the Bureau of the Census and Statistics then became the ex officio civil registrar general. Another law is the Presidential Decree number 856, known as the Code of Sanitation of the Philippines, approved on December 23, 1975. It says that the burial of remains is subject of the following requirements, such as no remains shall be buried without a death certificate. The death certificate shall be issued by the attending physicians, and if been there has been no physician in attendance or no available physician, it shall be issued by the mayor, the secretary of the municipality where the death occurred. The death certificate shall be forwarded to the civil registrar within 48 hours after death. This is according to this Presidential Decree number 856, Section 91. Another law is the Republic Act number 9858, which is an act providing for the legitimation of children born to parents below marrying age and amending for the purpose of Family Code of the Philippines. That's another law. Last one is the Republic Act number 10625, which is the Philippine Statistical Act. It mandates the PSA to carry out, enforce, and administer civil registration functions in the country. Under Section 2 of Act number 3753, the Civil Registrar General is empowered to prepare and issue implementing rules and regulations of laws on civil registration. These rules and regulations provide standard procedures which every LCRO in the country should strictly follow in registering all vital events, court decrees, and legal instruments. The CRG also prescribes the uniform and standard registration forms and prepares manual of instructions on the proper accomplishments of these forms. What is the flow of submission of civil registry documents? When a vital event occurs, the event shall be reported by the persons responsible within 30 days from the time of the occurrence to the city or municipal registrar. The civil registrar registers the event and compiles all the registered vital events on monthly basis and submits it to the PSA Provincial Office or PSAPO within 10 days following the month of registration. The PSAPO or the Provincial Office, PSA Provincial Office compiles the reports of all cities and municipalities within its jurisdiction and submits the same to the Civil Registration Service, PSACO, within 60 days after the reference month. So if there is birth to be reported and death to be reported, person responsible for the birth or the attendant at birth, the parents or the guardians, then should be registered and reported to the local civil register. If it's a death report, person responsible may be the attendant at death, informant, or the physician. Then go to the local health officer. That's all for today. And thank you everyone for listening to the topic.